Dr. Cripe, when someone needs a breast surgeon, what should I be looking for?
I think that's a great question. A number of women will have to have a breast surgery, and there are a number of surgeons across the country. And what are you looking for in a surgeon? One thing I think is very important is a fellowship-trained breast surgeon. So when you're trying to find someone, you want to make sure they have that additional training.
And what does that mean exactly?
So a fellowship is beyond general surgery residency. So we're all general surgeons, or there's another track that some of the OBGYNs can be breast surgeons, but typically you go through general surgery, 5 years of residency and training, and it's an additional year training just in issues with the breast. So the breast surgery fellowship is a 1-year training that you do general surgery of the breast, but we also do a number of other things and other advanced techniques. We do medical oncology, radiation oncology, and we go through all the different subspecialties, pathology, radiology, to learn what all goes into treating a patient with breast disease. Also, with having a fellowship-trained surgeon, hopefully we're going to be more up-to-date. We have a desire to learn and continue to kind of push the envelope, so it's not just status quo, but we don't want to do what we were taught necessarily. We want to continue to learn and strive and do better from a cosmetic standpoint, from aesthetic standpoint, but also from a patient outcome, reducing morbidity. Those are all things that we want people to have, hopefully better surgery with less complications, to feel better about yourself.
And Dr. Halaharvi, you both perform mastectomies together. Can you talk about that?
Yeah, so I've been pretty fortunate to perform mastectomies, Dr. Cripe, and for the people who don't know about us, Dr. Cripe trained me in my fellowship and also in my residency, one of the surgeons who trained me in my residency. And so our techniques of operating are pretty identical. And so we do a lot of double or the bilateral mastectomies together, which cuts down time under anesthesia for the patient. And across the country, only 14% of the breast surgeons actually perform this surgery together. The advantages of that are, of course, less time under anesthesia for the patient, less fatigue or tiredness for the surgeon, and less cost to the insurance companies. And we both learn newer techniques and teach each other, so we are growing exponentially just from working together. So.
And Kelly, did you know that you were going to have 2 surgeons operating on you?
Oh, when I found out, I was really excited. It made so much sense, and I've grown up in a medical family and been around physicians all my life, and it never occurred to me that physicians could pair up like this and do that. And so when I heard it, and they, the less time under anesthesia, it was very exciting just to know, one great physician, and then you're gonna have 2 great physicians. You really feel like you're it's the ultimate in patient care, I think.
Do you want to talk about what type of surgery you had?
Sure. So I actually underwent what they call a goldilocksmastectomy. Prior to my diagnosis, I had no idea what that was. Was very excited to learn that undergoing a double mastectomy, a lot of women are obviously flat or sometimes even concave on the body. And because I was a larger breasted woman, they could take some of the extra tissue, or skin, I should say, and fatty tissue. Obviously all the breast tissue's gone, but take everything that was left over and kind of form it into a small breast mound so that I don't have to be completely flat. People that aren't going through this may not think that that's that big of a deal, but for the esteem of a woman, and I can put on a t-shirt and not have a bra on, and be fine. Nobody notices, nobody, it doesn't look any different than anybody else. And it just normalizes things as you're going through those early stages of such a radical change in your body. So I'm very excited to have been able to undergo that procedure as well.
That's great.
Yeah.
Yeah, so there's different types of mastectomy. There is what we call flat closure for these women who don't want any type of reconstruction. And so after we remove the breast tissue, the incisions are flat and there's not excess skin. So that's really big preference for the patient, and patients can have reconstruction. Where I always describe breast like a pillow and a pillowcase. So as breast surgeons, we remove the pillow, and the pillowcase is what the plastic surgeons take to do reconstruction. There's 2 types of reconstruction. One is where you can use your own body tissue to make reconstruction. The other is where you could use implants or temporary implants called the tissue expanders. They expand that over time and change that out into permanent implant. And then there's nipple-sparing mastectomy, where we can preserve the nipple as well as the skin. And so there's different types of mastectomies. It really depends on the type of cancer, how large the cancer is, and the breast size, and so on and so forth. Goldilocks mastectomy is fairly new procedure that Dr. Cripe and I have been doing together. It's been great to do this with Dr. Cripe because it does cut down time under anesthesia, because it does take a while to do the procedure.
Yeah.
And so, less time for you under anesthesia. So
Yeah.
that was really beneficial. And we've operated since after your surgery, multiple other patients.
Yeah.
And so we are very pleased
Very
that we can do that
exciting.
together and offer that to our patients. So
Yeah.
We went from always doing an old school mastectomy, removing the skin, nipple, areola. It used to remove the muscle. Then we stopped removing the muscle. And now we stopped removing the nipple and areola. And now we've moved into using your own tissue to kind of roll it up and do the Goldilocks mastectomy. So we continue to kind of push the envelope because we want to get better and better. And it's not a one size fits all for patients. And I think having a fellowship trained breast surgeon is going to know that a little bit more and look at each individual patient as a unique person with different goals.
Yeah, definitely.